All right, hello again everyone. It's Rendi Murphree with Mobile County Health Department here to give you our daily 2:30 update on our response to the COVID-19 outbreak that's affecting people all over the world and us nationally and here in in Alabama, sorry. So first I just want to review the count of confirmed cases that have been reported by the Alabama Department of Public Health. This is at 10:05 this morning. They're reporting 46 confirmed cases among 11 counties, and we have no positive cases in Mobile County at this time. As we have promised, we will let you know as soon as we find out about the first confirmed case in Mobile County. We've seen a rather rapid acceleration of the number of cases since we had the first identified case on March 13th. So it's gone from 1 to a dozen or so to in the 20s and the 30s, and now we have 46 cases. So this is really concerning, and we're doing everything that we think we need to do to try to keep our agency safe and operational, and also to try to help protect the community. I won't go through the list of health clinics that have been closed by Mobile County Health Department today. Those are available on our website. These closures and sort of the consolidation of essential services and asking non-essential staff to stay at home really is in an effort to try to protect our facility. So we want to try to keep essential functions up and running as long as we can, and we have a lot of employees who have children that are affected by the school closures. And we are doing our best to try to, again, consolidate where we think it's prudent to do so and keep clinics open so that we can continue to maintain services. We have limited staff, we have limited supplies. So again, we appreciate your patience. We know it's been a challenge with people who have had appointments that have been canceled. We apologize that not everyone received a call to say that we were going to have to cancel your appointment. But again, if you want to give a call, we have the medical triage line, the pharmacy refill line, a COVID-19 information line, and then those are all available online. The new number that I would announce if I had it here in front of me is for WIC services. So we are providing WIC services at our Newbern Clinic. Call our main triage line and they'll be able to direct you about where to call for that. So many of you are probably going to hear about a new health order that was just released around 12:30 today by our health officer, Dr. Eishold. I'm not going to go into that at length right now, but it has some fairly important and some will consider austere measures that need to go in effect by 5:30 today. The reason I'm not going to go into detail about it here is because he's going to be speaking about that on a public call with the mayor, and this is going to take place at 3:30 today. And Mark, I'm not fine, no, oh, here it is, sorry. So you can find that number again on our Facebook site as soon as we're done here, but the dial-in number is 605-313-5820. The access code is 494200#. Again, this is a 3:30 call, we're told at this time, where our health officer, Dr. Bert Eishold, will join the mayor talking about a health order, a health directive that goes into effect today. The dial-in number is 605-313-5820. The access code is 494200#. So go there and listen to our health officer and our mayor discuss those public health measures. I do want to emphasize that while these may seem extreme, they are in line with what's going on in the northern part of our state. Jefferson County has seen just a rapid increase in the number of cases, and they have implemented similar measures in Jefferson County and surrounding counties, and we're trying to get in line with some of those community mitigation efforts quickly and soon so that we can try to reduce the number of cases and the amount of transmission that we might have going on about the community. So on to testing. So I've gotten a lot of questions about testing, like, do we just not have cases in Mobile County yet because there's not enough testing going on? And I think The answer to that is yes, we probably have coronavirus transmission going on in our county. I said yesterday it's a bit naive to think that we don't. As much as we are trying to expand testing at sites throughout the county, it is still a bit limited. And I just want to say, like right now, the Mobile County Health Department is not able to open public sites for coronavirus testing. We were hoping we might be able to, but just with limited staff and supplies, we're not able to do that. So at Mobile County, like many healthcare facilities and many clinics, we're only able to test our current patients who have the risk factors and the symptoms that really advocate or prioritize folks for testing. I do want to say, I want to thank our other federally qualified healthcare centers that are partnering with us to sort of align what we're doing so that we kind of are all on the same front. Mosteller Clinic, also due to limited supplies of testing kits and masks, Mosteller Medical Center is currently only testing established patients who have respiratory symptoms for the coronavirus. So you can call the Mosteller Clinic if you are a Mosteller patient at 251-824-2174 to see if you would be eligible for testing as a patient of the Mosteller Clinic. We've been asking our other clinic partners, community clinic partners, and hospitals to please let us know what they're doing so that we could share it with you. Mobile Infirmary Health did share a statement that we will post on our Facebook site. It says if you feel ill, please do not go out into the community and risk infecting others. If you feel that you've come in contact with COVID-19, please call the Alabama Department of Public Health's 1-800 hotline at 888-264-2256. Again, the most important message is call ahead to your healthcare provider or your home, your healthcare home or your medical home to see if they're able to do testing. About the hotline at the ADPH. ADPH announced last week and earlier this week that they had planned on opening 20 to 23 testing sites around the state. I heard on a phone call yesterday that had been held up somewhat because they had been unable to receive the supplies that had been promised to them because the federal government had canceled some orders and were diverting resources to the Strategic National Stockpile. So a representative from the Alabama Department of Public Health has said that the locations of the sites identified by the Alabama Department of Public Health and the Alabama Hospital Association are not being released to the public at this time. The sites will be operational on various days and times depending on the availability of supplies. Please refer all requests to our toll-free number. They will have the most up-to-date information. Once they are able to release the information publicly, we'll let you know. And again, that 1-800 number for ADPH is 888-264-2265. That's the ADPH line for where can I get tested. So that's all the additional information I have on the 20 to 23 open testing sites that the Alabama Department of Health was hoping to get going this week. So just a couple of other things and then we'll take questions. We want to plead, the Mobile County Health Department really wants to use this opportunity to plead with big box pharmacies and grocery store pharmacies to follow the March 14th guidance from the Board of Pharmacy, the Alabama Board of Pharmacy, that provide authorization, 30-day reauthorization of refill of prescriptions if you meet some certain criteria. This allows us to, to help people who are confined at home or who have been asked to work from home and maybe aren't able to get in to see their healthcare provider. And so, with just notification to a healthcare provider, you can authorize a 30-day refill on most prescriptions. And we've heard that some pharmacies, commercial pharmacies in the community are not following this guidance, and we just plead that you would, get in line and do your part to try to make prescription refills as open as we can be to those people who need sort of just, normal maintenance medications So again, Board of Pharmacy memo that was published on the 14th that provides for 30 days refills if certain conditions are met. One other point I want to make, we know that accessing vital records, so birth certificates and death certificates, is going to be very important to our community. Those can be obtained online, but there's a rather hefty fee. I think it's $25 if you apply online for a birth or death certificate. Because of that and us not being able to get a waiver of that fund, this location, Mobile County Health Department, is going to open our Vital Records Department by appointment only. So if you need a vital record, you may contact 251-690-8898 and make an appointment to come safely into our health department to apply for that vital record. Again, 251-690-8898 to visit Vital Records by appointment only. A couple other, two last things that I want to mention. One is we've gotten some reports of community members misrepresenting themselves as Mobile County Health Department employees and trying to shut down restaurants and things of that nature. And so this happens almost every time we have a natural disaster or have maybe something going on in the community. So we just want to make sure that you guys know that if you have a health department employee that's legit, they will have a badge and they can, just ask them to present that badge. And we just want to please encourage community members. We appreciate your help, but we think we have it for now. So just wanted to pass that along to kind of squash that. We are not out there in public areas telling them that they have to close. That will be addressed by the health order that's been published by our health officer. So learn more about that at 3:30. The last time we're getting calls about employees saying that their employer is requesting a negative test before they're allowed to come back to work, or some sort of statement about not needing a test in order to go back to work. And so I'm going to read this prepared statement and then we'll make it available on our website. If you call our COVID information line, we can also email this to you if you need it. At this time, the Mobile County Health Department does not provide or recommend COVID testing for employees returning to work after illness. Patients who've been ill and isolating at home should follow these Centers for Disease Control recommendations. You can leave home after these 3 things have happened. You've had no fever for at least 72 hours, that's 3 full days of no fever without taking medicine that reduces fever. And, this is and, so no fever for 3 days, and other symptoms have improved. For example, when your cough or shortness of breath has improved, and at least 7 days have passed since your first symptoms appeared. So these are the conditions under which you may lift yourself from self-isolation and report to work or move about the community. But remember, we still are encouraging social distancing, avoiding mass gatherings, hand washing, cough etiquette, all those sorts of things that you need to continue practicing if you have recovered and you meet these 3 criteria and you want to go back to work or move about your community. So I think those are all of the points that I had hoped to make. And at this point, we'll just go my right to left, taking questions. Does that seem fair?
Yeah.
Okay.
So one thing that we've been getting a lot of questions about, we're hearing of pre-screenings prior to entry versus testing. Can you kind of break down for our viewers what the difference is between these pre-screenings and actual testing?
Right, so the question is about sort of terminology and what is pre-screening, what is testing, what do those things mean? So I'll tell you what it means for us at the health department. So because we're trying to keep our healthcare spaces infection-free and contagion-free, that sort of thing, what we do and what many healthcare facilities are doing is they are screening people before the entry into their brick and mortar facility. So they're setting up tents, maybe in their parking lots, along, outside of their foyer, outside of their waiting rooms. And what we are doing and what they are doing is asking a couple of questions. Have you had cough? Have you had shortness of breath? Have you traveled recently? Have you been around anyone who's been diagnosed with COVID? And do you have a fever? And answering yes to some of those questions will not prohibit entry into the healthcare system for people who need it, but it might mean that we take you through a different entrance or maybe ask you to wear a mask when you come into the facility. Also, some people are actually measuring temperature of folks that are coming into their facility. That's what we're doing here, just to make sure that we're taking every precaution that we can to get people who need, sick people who need to be treated into the facility safely, and so that they're not spreading germs that might create a situation where we might have to shut, a health department clinic down because we have, a contagious situation there. So that's screening. There's also a term that we talk about, specimen collection. So testing really has two pieces to that. There's specimen collection and then laboratory testing. So specimen collection is what happens in your doctor's office or your health clinic or in the hospital. It's, conducting the nasopharyngeal swab and putting it in some transport media and boxing it up and sending it to the laboratory, where the laboratory conducts the test. So does that help explain sort of some of those different terminologies?
So if you're turned away from, from going in or maybe taken through a different entrance, does that necessarily mean, or that does not necessarily mean that you need to go get tested?
Absolutely not. In fact, the overwhelming majority of people who have mild illness, we're asking them to please go home and take care of their illness at home with, hydration and over-the-counter medications, and to stay at home until they meet those 3 criteria for coming out of self-isolation. So next over here.
So with the lack of testing that is in our area or happening at specific primary care physicians, USA Health is doing it for their patients, you guys are doing it for your patients, Stellar Medical Center is doing it for their patients. Is Mobile County, were you guys ready for a pandemic of this type of magnitude where people could be sick? Because as of now, you said 0 people in Mobile County, but you say it'd be naive to think that nobody has it.
Right, that's right. So we're never as prepared as we would like to be, but we have been preparing and planning and exercising for many, many years, not just on our own, but also with our healthcare partners throughout, not just Mobile County, but the region. And so we do feel that we have the skills and the things that we need to respond to a pandemic. Part of the issue with testing is that the testing materials are in rather short supply, and most of those materials are being diverted to the areas in the United States that need the most testing, right? So you have Washington State, California, New York, other states that are coming online every day with many more cases than we have here in Alabama. Would we like to have limitless testing? Absolutely. We would love to have as many swabs and transport media as we needed to test everyone, but unfortunately we just don't have that. We're trying to consolidate and conserve those resources, again, so that we can test our patients who are at the greatest risk or the most ill. So yes, we feel ready. We feel like we're taking the necessary steps. The things that were announced today in our health officers' health directive are not just things we pulled out of the air today. These are things that we have been talking about for years and years and years.
One more question. What do you guys hope about not having dining in service?
Yeah, so it's sort of multifactorial. So part of it is because we want to dilute the number of people who are in those spaces, because restaurant and bars are congregate settings. And so the step down effect was, at first we were saying, remember to plan, create social distancing, right? Then we said, don't go to areas where there's more than 25 people around or where you can't get more than 6 feet away. Now then we went to, okay, try to staff no more than 50% of your restaurants, right? And it is all about trying to create that social distancing.
But people are still handling the food.
Yeah, that's true, but it's, and in those situations, there are some different control measures that need to go into place, but in the physical location of the restaurants, it's trying to get people from sitting right on top of each other or at the next table that's just a foot or two away.
And staying there for long periods
of
time.
Right, and for close contact, we're talking about within 6 feet for only 15 minutes. So it's not a very long period of time that we would consider close contact. just to clarify that. Okay, over here, Hannah.
I wanted to find out, so there's still not a test site here for the Mobile County Health Department and still no positive cases?
Right, so I knew there had been some rumors that we were gonna be able to test 400 people a day. I don't know where that came from, but we had hoped and we had been planning for an open testing location at, with one of our partners, but we're not able to do that because of the limitation in testing materials and in transport media. So we've had to shelve that. I mean, we still have the plans, we still have everything in place. If our orders are filled at some point, we may be able to open that, but we're not able to do that at this time and not in the foreseeable, like not in the next week or 10 days, I don't think.
Okay, but still no positive cases in Mobile County?
0 positive
Okay.
cases in Mobile County.
And also, who is testing in Mobile County? Anybody that you know of?
So, we know that Mosteller is testing for their patients. And we've asked our other health clinic, community clinic partners and hospitals to self-identify, but, and they may do that and let us know, because we were very happy just to say, we will read whatever statement you prepare for us and we can let viewers know. Most people that have the testing capacity, most hospitals and clinics are only testing their patients. And so if you don't already have that patient-provider relationship, they're telling people to call that 1-800 number at the Alabama Department of Health where you can inquire about testing in your area.
Could you give us that number?
Yeah, let me read it again. I think I read it before you got here, but I can find it really quickly, sorry. So for, people who don't have that patient-provider relationship, they can contact ADPH at 1-888-264-2265. And this number went live, I believe, last Friday, or maybe it was first thing Saturday morning. And I was so curious, I called it myself and gave them my zip code, and they said, we currently have no open testing in your area, please contact your provider.
So the only testing you know locally is the Mosteller?
They are testing for their patients only. We know other testing is being done because we know other testing is being done, both at the state lab and through commercial laboratories. We think that, hospitals and other community health clinics are doing it, but we don't know that for sure, and we're certainly not at liberty to sort of announce that, because again, they're only providing testing for the most the most ill or the most highest risk, or their patients only.
And the reason why Mobile County Health Department isn't doing it is because you don't have the supplies.
Yeah, we just were not able to get the supplies that we needed to open, what we call a pod, a point of dispensing, but basically an open community testing location.
Okay.
Yeah.
Do you have an idea of how many people have been tested in Mobile County so far?
Well, no, I don't have a firm idea, and the reason is because negative tests are not reportable, and so we know there's testing going on. We get some negative lab results, but not all. But only the positive lab result is the one that they're required to call us about in 4 hours. I really wish we had an idea that we could tell you, but I just don't have a good answer for that right now because I don't know.
You said you called.
Oh, sorry. As to the guidelines, are we still going back to that same table that we had seen on the Alabama Department of Public Health website?
No. So you're referring to the table that had sort of the five criteria for testing. The ADPH is no longer using that criteria. So basically they are saying that it's between a patient and their provider, so the provider can use their discretion. We would like for that provider to use some, like I say, discretion and some other things, like think about the epidemiology in the local area, thinking about the patient's previous travel history, have they been to states or countries with ongoing sustained community spread, and how ill are they? Do they have another explanation for their illness before they just order testing? But that ADPH has backed off of those requirements, and they are basically allowing testing at a provider's discretion. They also have changed the process by which a provider can request testing through the state laboratory. So you no longer have to get prior authorization. There's an online form that a provider can just complete that form, press a submit button, and then they'll get an automated email with the instructions about specimen collection and getting that specimen to the laboratory. It's all at alabamapublichealth.gov.
You said you called the number yourself for the state, the ADHP, and there's no testing here.
Mm-hmm.
If someone really wanted to get testing, they feel that they are sick, should they travel to a place that has testing?
Absolutely not. Again, whether you have the test or not, or whether it's positive or not, our advice for a person with fever or cough or shortness of breath is to stay at home. We certainly don't want to drive people to border states or to other counties where those resources are already in, are stretched to the max just like we are. So we don't want people sort of doctor shopping for tests or going to other geographies to try to get tests. So what we, again, are asking for patients staying at home if you're sick. If you can manage your sickness at home with over-the-counters and fluids and those sorts of things, stay at home. If you're in one of those high-risk groups, over 60 or 65, have underlying medical conditions, and you are not able to take care of your illness at home, if you're sick enough to require emergency or urgent care, then we certainly want you to seek that out, but please call ahead and let them know what you're experiencing and that you need to come in for a higher level of care.
You used to work at the CDC for a while. This is, are we at a critical point, the fact that we are going to be banning people from eating at restaurants, where we are trying to contain something, even though we have no positive cases here yet?
Yeah, it's definitely unprecedented, and we, our leadership staff have been having command calls 3 times a day, and at the one this morning as I was driving in, it really hit me that we've shut down probably 80% of our services at the Mobile County Health Department to try to protect and preserve and sustain essential operations in what is an unprecedented public health time in my lifetime and in modern history, I think. And so I am surprised and taken back by it, but I believe we're doing the right things in order to try to protect our communities. And we need the help of the community. I know this health order is going to be hard on daycares and schools and parents and churches and nursing home facilities and those sorts of things. We realize that it's going to be difficult, but we need everyone's help to try to protect the community from the coronavirus transmission being here and taking hold in our county.
Rendi, I have one more question.
Yes, ma'am.
Specifically, when do you think, although we don't have any testing sites set up now, when do you think that testing sites will be set up in Mobile, and when will you guys be able to do some testing? Any timeline on that specifically?
Not specifically. I've heard a date thrown out that's almost mid-April, that it could be April before we have testing. I hope that tomorrow or Monday we have better, or Friday that we have better news than that, but we just can't say at this point because again, I heard on a federal call that orders that had been placed by states and many other jurisdictions had been, for specimen collection supplies had been canceled by the federal government, and those supplies diverted for the Strategic National Stockpile. So that puts us sort of back to the end of the queue for trying to get our orders filled. So it could be a week to several weeks.
Is it still just a couple day turnaround period on getting those results back, or how long is that?
Yeah, so you'll see in the news that there are some laboratories that can turn a test around in 4 hours. We've heard of this commercial laboratory in the Birmingham area that opened a drive-through clinic, and they promised clients results back in 4 hours. So there are some laboratories that are doing a high throughput test. For the state public health lab, it can take 24 to 36 hours, I think is what the state health officer said, to turn those results around. And they're hoping to, expand testing and have more people conducting testing to try to speed that up. And I've heard nationally that they're, the federal government and the coronavirus task force is trying to get more of those high throughput, more rapid tests out in the hands of commercial laboratories. So I expect that it will, that the time for testing will get shorter and shorter.
So if someone thinks that they have the coronavirus, should they call the Mobile County Health Department?
They can. We hope that we're prepared to take those calls, and we have Right now, staff dedicated to receive those calls. What we will say when you call is, what are your symptoms? Do you have a fever? Have you measured your temperature? When did your fever or cough begin? In the 14 days before that first symptom appeared, did you travel outside of the state? Where did you travel? If you traveled within the state, where did you travel? Have you been around anyone who's been diagnosed as having COVID-19, sorry? And if they answer yes, then the question is, can you manage your illness at home? If they can, we ask them to stay home and manage that illness at home and isolate themselves and take care of those, disinfecting your home and keeping it health and safety and isolating yourself from others and not going out and all of those
But then
things.
how will they get tested from that point if it's not offered here where they are not spreading it to other people?
So they won't. In that situation, we just cannot offer testing for that scenario at this time.
So in the release you guys put out about the health order, I know you're not going to talk a lot about this. We got a question from a viewer about how, let me review the part from, all daycares and schools within 12 or more people should remain closed as per the order of the Alabama Department of Education. A viewer calling us says she owns a daycare, but that's not under the Department of Education, it's under the Department of Human Resources. When she called the Human Resources Department with Alabama, she got no answer. There was a vague answer about that. Is it ordered that all daycares must shut down by order of this order?
Yes.
Or would it be from the Department of Education order?
No, well, it could be either or both. I think what this question is getting to is who is going to enforce the order. And so the order is the order. And the enforcement of the order then gets a little bit more muddy. And so, we're going to hear this because people are going to try to explain their way around not having to comply with the order, because I'm not under the Board of Health, I'm under the Board of Human Resources, or I'm under the, Alabama Beverage Control, not, restaurant inspections, and so we're going to hear this. So the order is the order, and it stands as written, and everyone will be expected to comply on the timeline that has been given. The muddier part is who is going to enforce that, and that's when it gets to being the regulatory agency that governs the child care versus restaurants versus schools versus those sorts of things. So I think that's where that question is coming from. There are subtleties and differences in that about who will enforce the order.
I assume licenses could be suspended if they don't follow what you guys have put out or what's already been put out.
Potentially. I think anything's on the table at this point. And we have gotten some questions about, not everybody even knows about the order yet. So if I shut down my restaurant because I know about the order and the one next to me didn't know about the order, how is that going to work out? And so we will do our best to get the information out to everyone. We're working, with other agencies in the county and city to try to get that message out in other avenues, business license holders, those sorts of things. So we'll try to get it out as quickly as we can.
We've heard a lot about this virus impacting our elderly citizens, but one group who we haven't heard too much about is possibly pregnant women, mothers of newborns. Do they also need to take the same precautions as elderly and immunocompromised people?
So as far as we know right now, pregnant women are definitely, a sensitive population, and we want to really do everything we can to try to protect them and their babies. Right now with this virus, we're not seeing sort of more severe symptoms or complications with pregnant women, but they should sort of listen to those distancing and isolation recommendations and adhere to those to the extent possible that they can. We still want them going in for well baby exams and with appointments and those sorts of things, but everything I've seen about the severity of illness, it does not appear that pregnant women are falling into that higher risk category.
What's your biggest concern? I know that we're kind of inundating you with a lot of questions,
That's
but
okay.
just kind of overall, what would you say the top thing or just the one thing that is most concerning about everything right now?
I think because this is an unprecedented time, people are, justifiably confused and concerned and maybe even a little bit afraid. And I think trying to help calm that so that we can really effectively work as a community to work together to try to, mitigate what's happening, that concerns me a bit. We've already, last week we started seeing, supplies running out at grocery stores and all of those kinds of things. I think right now what concerns me the most is that we've been asking people to plan, and we've been asking agencies to plan, and now we need that planning to kick in. And these have not just been sort of false prophecies, right? We've not been saying plan just because, it's a good thing to do and we didn't think we'd ever need it, right? We have been thinking that we would need it. And so we need people to help us by following the order, by, following the recommendations of public health to create this sort of social, distancing, this sort of diffusion of congregation in our community to try to reduce the spread of this very infectious virus. And I worry about people saying, well, I'm not going to do that, or I'm not going to do that, and they're not realizing that while they may be healthy, they may be unknowingly infect somebody who's in one of those highest risk groups that's going to have severe complications and potentially death. And so we just need everyone at this time in our lives and in our health care and our public health to come together and try to work together to all do our part. Okay, any other questions before we wrap for today? And then James is looking, did you have anything from Facebook, James?
I had those WIC numbers that you were looking for earlier.
Okay, so James has the WIC number. He's going to read it to me.
Okay, if you have a pickup or a web class that's due, you can call 251-694.
I don't have a pen. Hold on, sorry. So if you have a what?
If you have a pickup or a web class
or
that's
a
due,
web class that's due, this is talking about WIC, you can call 251-694
3942.
3942. Can you read it to me again, James?
251-694
694
3942.
3942. That's again for women, infants, and children's pickup or online
web class.
web classes.
Yeah, and if they have any other questions about WIC, they can call 251.
For other WIC questions, you can call 251-690
8829.
8829, and we'll make sure to put those on our Facebook page so that you can grab them there. I just want to make one last comment to our employees who are at home. So we're all working really, really hard to try to preserve, essential services for the health department so that we can help those that are in greatest need. We know a lot of you are at home and you have questions, and we're thinking about you and we'll be checking on you, and please stand on the ready because we may need your help at any time to come in and help us here and maybe send tired or fatigued people home, or folks that are here that need to go home and care for their children or loved ones. So if you're watching from home and you're an Mchd or family health employee, thank you for your part in what you're doing, and hang in tight and stay healthy out there. Okay, thank you.
Archie's so happy.